Hi, it is Dr. Lanice, and I am a best-selling author, speaker, blogger, and I take care of sick babies for a living. I love to help tired, stressed out, frustrated moms who have preemies in the NICU. I want to help them better understand what's going on with their baby, more effectively communicate with their NICU team, and most of all know that they can make it through the NICU journey and that they do not have to do it alone. So I am back today on another Wednesday at 7 p.m. Eastern Standard Time for another Facebook Live where I talk about all things preemie and all things NICU. So even though I talked about this before, I wanted to talk to you again about the preterm birth rate. So I really want to talk about preterm birth rate, lifetime insurance caps, and why you need to be concerned. So like I mentioned, I did touch on some of this before, but Facebook would not let me be great. It cut off the video after a minute and 30 seconds. So if you weren't on the live broadcast, then unfortunately you were not able to see the entire thing. So I'm going to cover that today, and I thought it was a really good time to talk about this now that the Better Care Reconciliation Act has been proposed, and so we kind of have an idea of what some of those effects might be. And I want to talk to you today about what this means for preemie families who are going to have, potentially kids who have chronic issues and will need lots of health care coverage. So we are going to talk about that. So the first thing that I want to discuss is, so what is the preterm birth rate? So this is the rate, the number of babies who are born alive at less than 37 weeks gestational age, or basically completed weeks of pregnancy. So if you are a mom and you delivered your baby at 36 weeks or below, baby was born alive, and all that goes into the number when we calculate what the preterm birth rate is. So this is important because we know that worldwide or globally, we know that prematurity is the leading cause, the number one cause of death in children less than 5 years of age. However, when we look at the United States and we look at the infant mortality rate, which is the number of babies out of all those who are born in the first year of life that pass away, that die, we know that prematurity plays a role there, and that's certainly one of the causes. So we had to take a closer look to see kind of what's going on with that and what can be done about it. So several years ago, many different organizations and advocacy groups came together to sort of specifically look just at prematurity. What can they do? How can they help pregnant moms, making sure that they get adequate health care? What can they do to sort of lower the preterm birth rate and make sure the babies and moms have adequate follow-up and care afterwards? So this all came under the umbrella of the initiative called Born Too Soon. And essentially back in 2010, they released a report where they compared the preterm birth rate across 184 different countries, because they realized if they were going to make a difference, then they had to be able to compare one country to another to find out what the different preterm birth rates were, so they could see if they were improving and what some places were doing better and how they could get other countries to do the same thing. So if you go back and look that up, and obviously sometimes the data is a little bit behind, because if it's released in 2010, then that means we're looking at data from babies who were born before that. But at that time, the preterm birth rate in the United States was 12%. And when you saw where they ranked against other countries, we were actually ranked at 54. So that means that our preterm birth rate was basically worse than 130 other countries that were included in the report. So it's very interesting when you think about, we're the United States, we're an industrialized nation, and you would expect that we'd have really good health care. So, more needs to be done. We need to take a closer look to find out why that is. Why are we doing so poorly compared to other places? Because ultimately this is, again, going to impact our infant mortality rate. So we know that the CDC in 2014 said that 23,000 babies died in the first year of life, right? So that is not a small number. So if we want to bring that number down, we want to decrease the number of babies that die in the first year of life, we're absolutely going to have to address prematurity, like what causes preterm birth rate, what can we do better there? And then we have to look at some of the other causes of why babies die in the first year of life. So back at that time, the preterm birth rate in the US was 12%. Now it's actually 9.6%. And so you might be thinking, well, that's great, right? We've come down almost 3% in 7 years. But actually, it's not really because we're doing so much better, but it's actually because we've changed the way in which we define sort of what the gestational is for baby, or how it's calculated, right? So if you've ever been pregnant, you know that when you go in, they ask you when your last period was, because that can help determine how far along you are in your pregnancy. But as you can imagine, sometimes it might be hard to remember, and so that might not be the best or most accurate way to determine that information. So now they use other things. They use that, they use what it looks like on ultrasound, and they sort of put other factors in together to say, okay, this is, you know, how many weeks you were at this time or when your baby was born. So when they use that and sort of rolled that out and then made the calculations of who was born premature and who wasn't, then the overall rate for the United States was 9.6%. So you can take that with a grain of salt. It's less, but again, the way we calculated it was a little bit different. So one of the things that the March of Dimes is doing as part of this sort of Born Too Soon initiative and everything else, they are sort of grading the United States on how we're doing with our preterm birth rate. And so for this 9.6%, on the most recent sort of data or scorecard that they did, we have a letter grade of C, right? And that's again with A being the best and D and F, of course, being the worst. So that's definitely, again, indicating that we have more work to do. And essentially by 2020, they would like to bring the preterm birth rate down to 8.1%. But when we sort of look at the data, if you look at it, you'll see a map of the country. You can see what areas of the U.S. have a higher preterm birth rate than others, what areas are doing well, and other areas that are not doing so well. And the other thing that they did was they actually broke it down by race. And so interestingly, when you look at it, we could see that the preterm birth rate for Black women is higher than any other rate. It's 13% compared to 10% in American Indians and Alaskan Natives compared to 9% in white or Caucasian women. So this is very significant, and you can imagine if any effort is going to be done to bring down the preterm birth rate, you have to take a closer look at why there is this disparity. Why is there this big difference in what the preterm birth rate is for Black women compared to everybody else? And unfortunately, if you do the research and you kind of look at the information over the last several decades, this difference has been there, and we really haven't addressed it up to this point. So we may not always know why a mom comes in and why she delivers early and why she goes into early labor, or why some women of one race do it other than another woman. We need to look more into that. But what we certainly do know are some of the risk factors that make you more likely to deliver early. So let's talk about some of those. So one is age, okay? So we know, research has shown us that if you are a teenager and you get pregnant, when you deliver, you have a higher risk of having a preemie, delivering early than another mom, okay? So it's sort of, though, on both ends of the spectrum. So if you are in your teens, you are much more likely to deliver early, but also if you are a woman who is 35 years or older, that also puts you at a higher risk for delivering early. So you want to keep those things in mind as well as you kind of think about, well, what puts me or you as a woman at higher risk? Another thing is weight. So if you are somebody who is overweight, your doctor has told you that you have a high BMI or body mass index, or even if you have, if you're very, very small, we know for women who have a significantly low BMI as well, both of those are things that can increase your chance of delivering early. So that's something that you also want to look out for as well. We know and have always known, right, smoking, alcohol, and drugs do not mix with pregnancy, right? Those are things that you should not do, and we know that all of those are risk factors for women to deliver early. We also know that for smoking as well, that can affect how babies gain weight during pregnancy. So if you are a mom that smokes, not only are you at a higher risk of delivering early, but your baby is also at risk for being much smaller for their age than they should be as well, which also adds sort of more complications to things. There are other risk factors, like if things are going on with the placenta and where it's located on the uterus, or if you're having lots of bleeding, or there's concern that there's separation of the placenta from the uterus. All of these sort of are factors that might cause you to deliver early. If you have high blood pressure and you come in and the doctor tells you that you have preeclampsia, we've talked about this before, the only way to treat that is to deliver the baby. So they can do some things, they can start some medications, but if the blood pressure is not responding and it's not coming down, then unfortunately they have to go ahead sometimes and deliver moms. And so again, that's a reason why moms can deliver early as well. And we also know that mental health sort of plays a role. If you have history of depression or anxiety disorders and things like that, we know that all of those put you at a higher risk to deliver early. So again, we might not always know why one mom goes into early labor over another, but we certainly have an idea of certain things that put moms at a higher risk. So again, if we look a little bit more closely and we say, well, what's going on with race, right? So why is there a difference there? Research and studies that have been done before, they kind of just said, well, you know what, We think that it's due to the socioeconomic background, meaning basically if you were from a poor area, a poor neighborhood, you didn't have a job, then you didn't have insurance, and so you weren't going to get good prenatal care because you probably weren't going to come in, and so that's the reason. So they said there was a higher percentage of Black moms who had these issues, and so that's the reason why they were more likely to deliver early. And so it kind of has just been swept under that rug, and so we haven't really looked any further into it. But now, finally, we have some additional studies that are coming out that say, you know what, if we take a mom, a Black mom, who makes a certain amount of money, who lives in a certain area, who has completed a certain level of education, and we compare this to another Caucasian woman who is similar, the Black woman is still more likely to deliver early. In fact, if you compare that same Black woman to, let's say, a Caucasian woman who's a teenager, and who is in what you would want to consider like a disadvantaged background or a poor area, the Black woman is still more likely to deliver early. So we can't just say it's due to coming from a disadvantaged background or being poor. We know that there has to be more at play there. And so we need to actually put more focus and energy into figuring out what that is. In fact, if you compare some Black women who have been, born or grown up in other countries and then come to the United States and live here and deliver here, they are less likely actually to deliver early than women who have grown up and lived in the United States and deliver, become pregnant and deliver here. So there's lots more that needs to be done to sort of tease that out and sort of look into what these different differences are. So when we're looking at this and we're looking at all these factors and we want to improve the preterm birth rate and we want to improve, we want to decrease the infant mortality rate in the United States, it seems like we're sort of doing the opposite when we're sort of looking at where we're going as far as healthcare at this point right now in our country. So last week we finally got what the proposal is going to be for this because they want to dismantle the Affordable Care Act. So now they have this new initiative that they're rolling out. And so we now have some information about what this is going to mean. So we know by looking at the data from this that if they actually go forward and they sort of do this better, Care Reconciliation Act, we know that there's going to be millions of Americans who actually will lose their health care coverage, and we know that over 6 million of them are estimated right now to be women. And if we look at the studies, they let us know right now that about close to 50% of pregnancies are actually covered by Medicaid right now. And we know that through the Affordable Care Act, Medicaid was expanded so that more coverage could go out to low-income families, to pregnant women, to women who have disabilities. So we know that our pregnant moms are going to be covered, and then we know that a lot of our children also are covered by Medicaid as well, especially our children who have chronic issues. So now when we're looking at anything that's going to be bringing cuts to Medicaid, obviously this is going to sort of impact this. So if you are a woman who is going to now end up not having health care coverage, right? So you're more likely not to be able to show up for your prenatal care appointments, and likely you're not going to show up into the hospital probably until the time that you're delivering or something is wrong, which you can imagine might put a mom at a higher risk to deliver early, right? They're also doing things like defunding Planned Parenthood, right? So studies have also shown us that the rate of teenage pregnancy has been going down over the last several years. And you have to imagine that it's due to programs like that, like Planned Parenthood, where they can go and they can get contraceptive, and so they can make sort of more responsible choices, and which has led to decreased pregnancies in the teenage population. However, if we do away with this, right, then these low-income families or these young women will not be able to go in and get health care, and therefore you can imagine that this might lead to an increase in the number of unplanned pregnancies. And like I mentioned before, right, being a teenage mom is a risk for you to go into preterm labor and then to end up having a preemie. This is also a big deal when we talk about insurance companies and how right now with the Affordable Care Act, they're not allowed to put a lifetime cap on your coverage, which basically means they can't say, we're only going to cover like $1 million or $2 million, for your health care. And once you hit that, we don't cover anything else. That's what is meant by putting a lifetime cap on it. It's saying we're going to cover you up until this point, and when you reach this point, then you are responsible to pay out of pocket for those expenses. This is a huge deal when we talk about our preemie population, our preemie families. families, right? Because we know that it's obviously going to be much more expensive to take care of preemies than it's going to be for a full-term baby, right, who never has a NICU stay and who maybe goes home right after birth, or even if they come to the NICU, maybe it's a short stay. So we're comparing it to like our micro preemies, right, our babies who are, maybe 400 or 500 grams, who are going to have, an 8 to 10 or more week NICU stay. So we know that for some of these babies and some of the issues that they deal with while they're in the NICU, estimates have shown that their hospital stay could actually cost anywhere from $200,000 up to $800,000, right? So you can imagine if already before your baby leaves the NICU, they've already spent $200,000, and we're talking about, whether your cap could be $1 million or $2 million, you've already, taken a huge chunk of that out, right? And then we know as a result, we haven't been able to stop preterm birth, right? But we've gotten much better at taking care of these babies. So more and more of them survive and leave the hospital and go home. But a lot, we were talking about our babies who are born right at 23 weeks, 24 weeks. Some of these babies that are higher risk to have certain complications, things like cerebral palsy. They're more likely to, be dependent on a wheelchair and not be able to walk, not to be able to feed independently, and may need things like G-tubes. They're more likely to not be able to breathe on their own and to need things like tracheostomies that give them a permanent airway for them to actually be able to go home. So these are kids who are going to be chronically in need of health care and follow-up. They're going to be more likely to get sick. They're going to be more likely to need surgeries later on in life, or to have heart problems or seizure disorders or different things where they're going to need to have very good health care. So you can imagine what this means for families if they, could potentially come out spending almost $800,000 on a NICU stay, and then, we're talking about $1 million or $2 million cap. What happens throughout the lifetime of this child when they have other issues, where now the parents have to come out of their pocket and pay for these expenses without any assistance and without any help? And when we think about our low-income families, right, who might be struggling just to provide shelter for their children, to clothe them and to feed them, and now to add on this additional burden, you can imagine it just seems that this may not be a good idea, and that this is sort of moving us in the wrong direction as far as when we talk about our healthcare and wanting to improve things like our preterm birth rate and our infant mortality rate as well. So I also looked at this issue. Actually, I wrote an article that was published online at blackdoctor.org, and I was talking about the infant mortality rate and how in the United States, again, just like the preterm birth rate, there are many, many other countries that have a better infant mortality rate than we do. And as a result, we've been looking at what can we do about this. And so one of the things that's been suggested and has been getting popular over the last few years is using cardboard baby boxes. And the reason why is that in Finland, they used to have a very high, many, many years ago, decades ago, they used to have a very high infant mortality rate. And so they started this maternity package program where they put an emphasis on, disadvantaged moms, and they would give them this box. It was decorated, it was a cardboard box, and had like a small thin mattress inside that could serve as a bed for the baby. And it also had clothes and reusable diapers and blankets, all different things that new parents would need. And they would give them this box to sort of help. And it was also not just the box, but sort of a push to make sure that more moms would come in and get health care and be seen and follow up after their babies were delivered as well. So to even qualify for the program, a mom definitely had to be seen by 5 months of pregnancy. So now different areas, different hospitals in the U.S. are looking at different regions again, right, who have higher infant mortality rates, and they're saying, you know what, we know that SIDS plays a role in the infant mortality rate, right, that sudden infant death syndrome. And one of the causes of that is co-sleeping, right, where parents sleep with babies in the bed. And there are many different reasons why parents may do that, but one of them may be that they don't have a crib or they don't have a bassinet or somewhere else to put the baby. And we know that this puts babies at risk for dying in the first year of life. So now they're saying, well, can we use this cardboard baby box program? Can we give this to parents as a way to decrease the amount of co-sleeping that's taking place and to address the infant mortality rate? So we're looking at what other nations are doing. But people who are in Finland, researchers there are saying, you know what, it's not really just about the boxes, right? Obviously, there's concerns about, here in the United States, using the cardboard baby boxes. We have consumer regulations for cribs and for bassinets to make sure that they're safe. But currently, those don't exist for cardboard baby boxes, right? So we want to make sure that, number one, it's safe to use, even though it sounds like a good idea. But even the researchers in Finland are saying it's not just about the cardboard baby box, right? They did a whole initiative that was just about a push to make sure that these moms who are lower income moms or disadvantaged had good health care. So they made sure they got to their health care visits. They pushed a lot to make sure that these moms were educated and received a lot of education around what to do for their babies and making sure that they took care of their health care and then also the health care of their babies. So we know we have to use that same example here in the United States. We can't just take one piece of that. We have to look at the whole thing, right? It's not going to be about one small thing that we do, but one thing that we know that's going to make a huge difference for pregnant moms and for the babies is making sure that they have good access to health care. So this is actually very important to do, and so we have to sort of be aware and look at what's going on around us as we're talking about, doing away with the Affordable Care Act and looking at this new proposal and sort of moving forward. So there's many, many different organizations who are advocating on behalf of our moms and on behalf of our children, and potentially, the elderly and other individuals who are going to need health care or who are being covered by Medicaid. So you just want to pay attention to all that's going on, making sure that you let your senators know that, you want to make sure that your kids are going to be covered. You don't want their insurance to be capped. And we want to just kind of watch and move forward to see kind of where things are going. We may have to sort of reinvent the wheel now and see what are the other things that we can do to make sure that these vulnerable populations are covered if this new healthcare bill does go forward. So we've talked about the preterm birth rate. We've sort of talked about how insurance is going to affect that. But what can we do, right? We have to end on a positive note. What can we do? We can't control what makes moms come in and deliver early. We can't control what's going to happen with their healthcare coverage. But what is the one thing that you can do? You can try to do your best to make sure that you put your best foot forward, that you're in the best health that you can be before you get pregnant. So you definitely want to make sure, if you're thinking about this, if you're at the point in your family right now where you want to have a baby, you want to make sure that you meet with your OB doctor ahead of time. You want to find out, are you at a healthy weight, right? Do you need to do more? Do you need to lose weight? Do you need to gain weight? As I mentioned before, both of those can be risk factors for delivering early. You want to find out, what is your blood sugar level, right? Do you need to change your diet? Do you need to exercise more to bring that where it needs to be? Are at a point where, do you have diabetes already? And do you need to make sure that you're taking your medications and you're being compliant with that to make sure that your levels are going to be in a good place, right? Do you struggle with high blood pressure, right? You need to meet with your doctor and find out what can you do to make that be under very good control before you think about getting pregnant. So there's many things that you can do to sort of try to put your best foot forward, right? If you're training for a marathon, you're training for a race, if you want a job, you do all these things to study, to research, to prepare it. You want to do the same thing when you think about getting pregnant as well, right? You want to know your family history. You want to talk to your mom, talk to your grandma, talk to other aunts, right? Do you have a family history of delivering early and having preemies? Or do a lot of women in your family have miscarriages? Or even heart problems? Do you have other family members who have babies who have heart problems at birth? All these things are information that you need to know and that you want to let your doctor know so that they have a better idea of how to manage you and monitor you during your pregnancy. So also, again, right, things like taking folic acid, we know that that's important because we know that moms who take supplementation with folic acid during pregnancy decreases the risk of your baby having neural tube defects, right, where their brain and their spinal cord can be affected. And research has shown that it's actually better and beneficial for you to start taking this actually a year before you want to get pregnant, right? So all of this takes planning, and these are things that you will learn, information that you will know when you meet with your OB doctor beforehand to sort of plan this before you actually decide to have a baby. So this is what I wanted to talk to you guys about tonight. I hope that it was beneficial. I hope that you learned something. Like I said, again, I had talked about some of this before, but given what's going on with the new healthcare bill that's coming out, I wanted to talk specifically about how this will affect our families who have preemies who potentially are going to be babies who have chronic issues throughout their lifetime that are absolutely going to need to be covered. So I wanted to make sure that you got this information. So please share this video with other family and friends. I am Dr. Lanice, so please check me out all across social media as at Dr. Lanice MD. That's the at symbol, DrLauniceMD. So check me out. If you want to learn more about me, go to my website. It is www.drlanicemd.com. And I have a very special surprise for my preemie moms out there. I have a freebie for you. So I have my free audiobook that I want to give to you called 10 Things You Need to Know Before Your Preemie Comes Home. It gives you all the sort of insider details that you need to know to get ready, because often parents wait till the last minute to kind of get things moving and their preemie is ready to go home. So this has some great information that you definitely want to know, and it's free. So to get that, you can go to www.drlanicemd.com/free audiobook. So you will get my free audiobook, and if you go online and download that, as an added bonus, you will also get my free guide that has 10 tips for preemie moms. So you do not want to miss out on this important information, and please, again, share it so that other moms can benefit as well. So thank you for checking out my video, and check me out again next week on Wednesday at 7 p.m. Eastern Standard Time for another Facebook Live about all things preemie and all things NICU. Have a good night.